Arthrodesis, tibia-fibular joint, proximal or distal. The physician makes an incision along the tibia and the periosteum is stripped distally to the level of the calcaneus. Using a saw, the physician cuts through the neck of talus to mobilize and remove the talus as one large fragment or morcellized fragments. With the talus gone, the calcaneus can be seen. The distal end of the tibia is removed perpendicular to the long axis of the tibia. The physician uses a saw to remove the dorsal calcaneus and to create a flat surface for the arthrodesis. The two flat surfaces of the distal tibia and dorsal calcaneus are brought together to establish a varus/valgus and dorsiflexion/plantar flexion alignment. A cut is made along the anterior tibia parallel to the cut made in the neck of the talus, which creates a flat surface for opposing the neck of the talus. The bone surfaces are deeply scaled to prepare for internal fixation. Kirschner wires are used to place the tibia and calcaneus in apposition. Using an anterior cruciate guide, a pin is guided from the calcaneus across the fusion site to the anterior cortex of the tibia. Once satisfactory fixation has been achieved, cannulated screws are placed through the neck of the talus into the tibia. The wound is closed over a drain and a dressing incorporating plaster splints is applied. Marcaine is instilled through the drain tube into the wound. Arthrodesis, symphysis pubis, including obtaining graft. The pubic symphysis is a secondary cartilaginous joint located between the left and right pubic bones near the midline of the body. The physician makes an incision overlying the symphysis pubis. Dissection is carried down to the joint. The physician may harvest a bone graft. The physician closes the surgically created graft donor site. Internal fixation is applied to the fusion with screws and/or plates. The incision is repaired in layers. Arthrodesis, knee, any technique. The physician makes a long incision along the inside of the patella. Bone cuts are made to flatten out the joint surfaces of the femur and tibia. A U-shaped groove is made on the underneath side of the patella and a corresponding one on the femur. The patella is placed into the femoral groove and secured with screws. The physician makes an incision overlying the iliac crest, harvests a graft, and closes the surgically created graft donor site. The bone graft is placed between the joint surfaces. An external fixator compresses the joint surfaces. The knee is typically fused in 10 to 15 degrees of flexion. The incision is closed with sutures, staples, and /or stree strips.